What's up, ladies and gentlemen? This is Dr. Kenny, and welcome back to Neurosketch. Today we are going to discuss about one of the very special region, the axilla. So, to you, it might sound just as an armpit, but it's just such a busy highway filled with nerves, vessels, and lymph nodes. So, today we are going to break it down to discuss the boundaries and explore what passes in, what travels through the axilla, and ultimately making sense of why this region is such an important high yield to any anatomy student. So let's jump right in. Yeah, so this is how we are moving today, and without further ado, let's get started. So the axilla is also known as the armpit, and in this region below the shoulder joint, bounded above, the upper part of the arm and the chest. So it is a pyramidal shaped, and has it been pyramid in shape, it means it has got four walls and apex and base, So this is a high point because it's a highway because a lot of neurovascular bundles that are coming from the roots of the neck to the arm, they are passing through the axilla. So any nerve and vessels that you find them in the axilla, in the upper rim, they are passing through the axilla. This is why this is a highway, it's busy highway, filled with nerves and these neurovascular stuff. So as I've said, had it been a pyramid, it's got four walls, the four walls and apex and base. So this is the apex of the axilla, and this is the apex of the axilla. The apex of the axilla is forming the cervical axillary canal. It's a canal that connects, the root of the neck and the upper rim. So the structures, the neurovascular structures are passing, they are entering the axilla through the cervical axillary canal. So in other words, the cervical axillary canal can be considered as the entrance to the axilla, to the axilla. And then this is the base of the axilla. It's also known as the floor of the axilla, but it's the base of the axilla, but it is made up of the skin of the axilla and the subcutaneous tissues, the subcutaneous fat. Alright, so what about the walls? Let's start with the medial wall. So this is a view from above. So when you are cutting here, and then your cross section, and then you are viewing from above, this is what you can see. So medially, the axilla is bounded by, we have this muscle here which is known as the serratus anterior muscle, and I hope you know already what a serratus anterior muscle is. Discussion on the pectoral region, but it is also on the same side, on the same boundary, the medial wall. It is also made by the thoracic wall. The thoracic wall here, I mean the ribs, especially the first four ribs, and they are intercostal muscles. They are associated intercostal muscles. So these they make the medial wall of the axilla. And then the lateral wall is made by the upper part of the humerus, but to be precise, it is the intertubercular sulcus of the humerus, but also some muscles, the coracobrachialis muscle and the biceps brachii. Coracobrachialis muscle and the biceps brachii. So far we've already seen four boundaries, and we've remained with the anterior and the posterior wall. So let's discuss about the anterior and posterior wall. So this is the anterior wall because this region is the axilla. So this is the anterior wall, or the anterior boundary of the axilla. So the anterior boundary of the axilla is being made by the pectoralis major muscle and pectoralis minor muscle, as well as the subclavius muscle. So these muscles, together with the associated fascia, they make the anterior border, or the anterior wall of the axilla. And then posteriorly, it is being bordered by the scapula, of course, with the subscapularis muscle because the subscapularis muscle is found on top, on anterior surface of the scapula, and then the teres major muscle and the latissimus dorsi muscle, they all make the posterior boundary. But we have something very important here. Like, we are done with the boundaries, but we have this one we call the anterior axillary fold. And the anterior axillary fold is this region that can be grabbed by your fingers when you're you are holding it. And then the anterior axillary folds, it is the inferior most portion of the anterior wall. The inferior most portion of the anterior wall. Same applies on the posterior most portion of the posterior wall. We have the inferior most portion of the posterior wall. We have the posterior axillary fold, the posterior axillary fold. So what are the contents? What are the contents of the axilla? So the axilla is considered, as the passageway, the highway of the neurovascular stuff that are coming from the neck, from the root of the neck, to supply the upper limb. Okay, so we have the axillary artery, together with its associated branches. They are found on the axilla, but we have the axillary vein, the brachial plexus, the proximal part of some other muscles that we will we will see. But the brachial plexus and the axillary artery, which are closely within the axillary sheath, they are considered the major neurovascular structures that are passing through the axilla. Guys, I made a separate video on the brachial plexus because it deserved to be discussed alone. So I have a separate video. You find the video link down below and watch that video. And then we're not going to discuss the brachial plexus in this discussion. Idea, it was supposed to be discussed here, but I thought it would be a lot of things to accommodate in a single session. So you find the video and watch. And then today we are going to discuss about the axillary artery, the axillary vein, and the axillary lymph nodes. Axillary artery, vein, and the lymph nodes. Okay. All right. So but just to mention, I mentioned in the discussion of the brachial plexus, but just to mention as well here is that the axillary artery, especially the second part of the axillary artery, it has got special relationship with the cords of the brachial plexus. So in fact, the cords of the brachial plexus, we have the lateral cord. It is known as the lateral cord because it is lateral to the axillary artery. We have this medial cord. It is medial because it is medial to the axillary artery. And then the posterior cord is also posterior because it is posterior to the axillary artery. I couldn't emphasize more on that. So let's now discuss about the axillary artery. So the axillary artery is a continuation of the subclavian artery. At some point we discuss what a subclavian artery is. Maybe now we don't know what a subclavian artery is, but that's okay. So it is a continuation of the subclavian artery. So this is the subclavian artery. But as soon as the subclavian approaches the first rib, so this is the first rib, or just on the lateral border of the first rib, the subclavian artery changes name from subclavian artery to become an axillary artery. So axillary artery is a continuation of the subclavian artery, just lateral to the lateral to the first rib, or to the lateral side of the first rib. And then this axillary artery goes as far as the inferior border of the teres major muscle. So we have a teres major muscle and discuss that at the shoulder region. I think you will find also a video. So the teres major muscle here, the inferior border of the teres major muscle marks the end of the axillary artery. So the axillary artery at the inferior border of the pectoral of the teres major, it changes name to become a brachial artery. So it was subclavian artery. The lateral border of the first rib becomes the axillary artery, and then at the lateral border of the inferiormost border of the teres major, it becomes the brachial artery. So it is lateral to the axillary vein. And it passes behind the pectoralis minor muscle. Guys, the axillary artery is being divided into three parts, and it is being divided into three parts by the pectoralis minor pectoralis minor muscle. So this is the pectoralis minor muscle. This is the pectoralis minor, and the pectoralis minor is it's attaching to the coracoid process of the scapula, and so it divides the axillary artery into three parts. It is easy. The first part is just above. The first part is just above the muscle. So excuse my triangle here. It's not a perfect, but it should cover this part here. Okay, so assume it covers from here to here. All this region has been covered by the pectoralis major muscle, pectoralis minor muscle. Okay, so so the first part of the axillary artery, it is above the pectoralis minor muscle, above or medial to the pectoralis minor muscle. The second part is behind the pectoralis minor muscle, which means you cannot see this muscle, you cannot see this part unless you cut flap the pectoralis minor muscle. And then the third part of the axillary artery, it is below the pectoralis minor muscle. Okay, some people refer to below or lateral to the pectoralis minor muscle. So these are the three parts of this the axillary artery. Yeah, so soon we're going to see the branches of the axillary artery, and it's actually simple because the first part of the axillary artery has got two branches. The first part has got two branches. The second part has got first part has got one branch. The second part has got two branches, and the third part has got three branches. So it's 1 for 1, 2 for 2, 3 for 3. So first part, one branch. Second part, two branches. Third part, 3 branches. 1, 2, 3 branches. And I will ask you this question in exam, so you have to pay much attention here. All right, so the first part of the subclavian artery has got one branch, and that one is known as the superior thoracic artery. But it is also known as the supreme or the highest thoracic artery, So this artery supplies this part over here. Okay, the second part of the axillary artery has got two branches. Okay, the first one is thoracoacromial artery, and the second one is the lateral thoracic artery. So lateral thoracic artery. All right, so as you can see, this is the first part. The first branch of the second part is the thoracoacromial artery. The thoracoacromial artery has got branches. Okay, so the very first branch we call it the pectoral branch. So this is the pectoral branch of the thoracoacromial artery, and then the second branch we call it the clavicular branch because it goes about below the clavicle. It goes below the clavicle, so it is known as the clavicular branch. But we have a branch that is going to the acromion process of the scapula. So this one is known as the acromial branch of the axillary artery. And then we have a branch that goes in this direction, and this one you call it the deltoid branch because it goes to the deltoid, around the deltoid, the lining of the deltoid muscle. Alright, so these are the two parts of the axillary artery. The first part with one branch, the superior thoracic artery. The second part with the two branches, the thoracoacromial artery and the lateral thoracic artery. And then we have the third part here has got 3 branches as well, and this is the subscapular artery. The subscapular artery, this one, and you look at these two arteries. So this one is revolving around, it's like wiping around the surgical neck of the humerus, and same applies this one, but one is anterior, one is posterior, but these muscles, they are like making circumference. So these arteries, they are making circumference, and so these arteries, they deserve to be circumflex, correct? But one is anterior, one is posterior. So these muscles these arteries they are, one should be anterior circumflex and one should be posterior circumflex. But what is so circumflex about these muscles is because of the presence of the humerus. So this muscle, they're revolving around the humerus. I mean, they are, wiping around, they make circumflex around the neck of the humerus, and so we call them the anterior and the posterior circumflex humeral artery. Anterior circumflex humeral artery and the posterior circumflex humeral artery. So you should put the name humeral. Without the word humeral, it is not complete. It is not complete. Why am I saying so? Because you see this muscle, you see this artery here, the subscapular artery. So it has got two branches. One is going in this direction, but one is making, so it's like, making a turn to go posterior. So it is like so this is like making a circumflex, and so this is also known as the circumflex artery. But this one is circumflex scapula because it is being winding the scapula back, winding back the scapula. So without telling me this is the posterior circumflex humeral, without the word humeral, means you are lost. It is not complete. Same applies here. Without saying this is a circumflex scapula, without saying scapula, means you are lost. But the other branch of the subscapular artery could be the thoracodorsal artery. The thoracodorsal artery, goes, together with the thoracodorsal nerve to supply the latissimus dorsi muscle. All right. So sometimes if someone has got a bleeding somewhere here, distal, on this inferior part of the, maybe the brachial artery, so sometimes someone can compress the third part of the axillary artery against the humerus. So compression against the humerus so as to tackle the breathing, to tackle the breathing. But if maybe the breathing is not controlled, maybe we have like a damage of the vessels around here, so it can also be compressed on the superior part of the artery, just on the region of the artery from the axilla, from the subclavian artery. Alright, so let's now discuss about the axillary vein. So the axillary vein, this is the axillary vein. The axillary vein is made up of the union between the brachial vein and the basilic vein. So the brachial vein and the basilic vein combine to form the axillary vein, and then the axillary vein will continue as the subclavian vein, same as how the artery was emerging. And this is the axillary vein, and it goes to above the lateral border of the first rib. It changes to become the subclavian vein. All right, so guys, I think now we can discuss about the lymph nodes. So the lymph nodes of the axilla, they are organized in 5 groups. Okay, they are organized in 5 groups, and these lymph nodes, they drain the most of the upper rim, but also the breast is being drained partly by the axillary lymph nodes, but the upper part of the body, upper part of the trunk, the abdomen is also being drained. By these axillary lymph nodes. So these axillary lymph nodes, they are very, very important because they drain the upper rim, not limited to upper rim. They are draining the breast as well as the pectoral abdominal wall, the upper abdominal wall, and the pectoral region. A part of the breast, breast is being drained by to the contralateral side. To the contralateral side. Forget about that one. Okay. So it is found with deep within the connective tissue, fat, connective subcutaneous fat, and also it is divided. We have 5 groups of the axillary lymph nodes, 5 groups. And we'll have the first group, which is also known as the anterior group or the pectoral group. So we have the pectoral group here, and then we have the posterior group, which is also known as the subscapular group, because it is along the subscapular. You can imagine that way. But we have the lateral group here. The lateral group is also known as the humeral group. of lymph nodes, so the humeral lymph nodes, lymph nodes. So we have the anterior group, which is also known as the pectoral group, and then we have the posterior group, which is also known as the subscapular, and then we have the lateral group, which is also known as humeral. So we have anterior, which is pectoral, posterior, which is subscapular, and the lateral, which is the humeral group. As you can see, all of these, they drain into the central group. So all of these three, they drain into the central group, the central nodes. So they are draining into the central lymph node, and then this central lymph node, then it drains to the apical node, and guess what? This is the the cervical axillary canal, which was the apex of the axilla. So they are passing through the apex of the axilla to go to the subclavian lymphatic trunk. So these are very, very important clinically, and I will ask you a question also from here. I will have a question from here in your exam. So there's the supraclavicular lymph node. Sometimes people, they're including the supraclavicular lymph node, but this one should be on the side of the subclavian. So why are these important? Sometimes because it drains part of the breast. So sometimes if someone has got malignance or the cancer of the breast, it can spread these lymph nodes, and then they can lead into enlargement of these lymph nodes. So they are involved in malignance of like metastasis of malignance of the breast cancer. You don't know what the metastasis is, but I'm sure you will as you're moving. So obstruction of the lymphatic lymph nodes, these axillary lymph nodes, sometimes they may result into dimpling appearance of the breast, and this dimpling appearance, it resembles the peel of an orange. And so for this reason, it is also known as the peeled orange, like the peel of the skin of the of the orange. And it may result due to inflammation of the breast, like mastitis, but can very well be due to malignance of the breast, like in breast cancer, malignance of the breast. So it is very, very important clinically, and when you get into your clinical years, you learn how to feel for the enlargement of these axillary lymph nodes. They are very, very clinically pronounced, and you can never ever take them for granted. And so I will ask you questions in exam from this region as well. All right, so the lymph nodes, so as I've said, the lymph nodes can be enlarged, and as I've said, it could be due to inflammation or malignance. They can be enlarged. So sometimes, for example, during someone has got the breast cancer and they want to take the breast off, so they are doing mastectomy, which is removing the breast. But once they remove the breast, they also dissect the lymph nodes. Why? Because we've said this cancer may get access to the lymphatic drainage, and so they can spread throughout the body. So once they are chopping off the breast, they should also take out the lymph nodes. They should also take out the lymph nodes, and this process is known as the axillary lymph node dissection. Lymph node dissection. But sometimes they can be just taken for sampling, like they're going to do investigations about them, but can very well be due to mastectomy, removing the breast, and so we are removing all the chances that this cancer might have spread to somewhere else. You know what happens sometimes when they're doing so, when they're dissecting to remove this lymph nodes, they might incidentally they might damage some nerves. One of them is intercostal brachial nerve. So the intercostal brachial nerve is the lateral cutaneous branch of the second intercostal nerve. The lateral cutaneous branch of the second intercostal nerve, and it supplies the skin of the armpit, and the upper part the upper part of the human, upper part of the arm. Okay, but sometimes they can also, damage the long thoracic nerve. The long thoracic nerve also passes by here, so it can very well be damaged. And then if someone has got damage of the long thoracic nerve, we have the winging of the scapula, so it's known as the winged scapula.